Samantha Morton. I'm CEO of MLPB, formerly known as Medical Legal Partnership Boston. And I am a reformed and a reforming lawyer whose great privilege it is to look at law and policy through the lens of public health and community health, especially in terms of generating and testing and refining strategies that can tap into communities of care as partners in legal problem solving with the people they serve. I think that the key word in your question is rights. The notion of rights comes up in a lot of language, but it's not real for people, for human beings and groups of people until rights are codified in law and public policy. And our approach at MLPB is to expand the base of people who can help, of partners actually, who can help people understand their legal rights, risks, and remedies. Communities of care at systems levels should be accounting for people's legal rights, risks, and remedies in all of their care delivery and care planning, because these are untapped tools that can be leveraged to promote health and well-being. In fact, we tend to have in the legal community a kind of legal care system that is like the healthcare sick care system. And it focuses a lot on acute legal needs. If we can partner with communities of care and their workforces to be partners in problem solving, then we can promote prevention by helping people understand their legal rights and their connections to health and well-being earlier in the trajectory of a legal need. The pandemic has been challenging for an organization whose mission is to advance prevention, because the level of material hardship and legal need, especially around housing and evictions, has been so acute and crisis level. At the same time, we are excited to see colleagues in the health and human services ecosystem continue to embrace learning around people's legal rights, risks, and remedies that is more preventive. In other words, what are the rights that people have to help be safe and affordable housing? What are the rights that people have to certain kinds of economic entitlements that can make sort of weathering this huge storm, this huge material storm, easier and safer? And so we are buoyed that the pandemic focus on crisis management is now evolving into planning for recovery. And part of recovery is investing in prevention strategies, which includes legal problem solving before legal problems become legal crises. There's been a lot of attention paid over the last year, finally, to eviction moratoria and related policies at federal and state levels that can reduce, not eliminate, but reduce on tenants and homeowners the incredible hardship and risk of homelessness that comes with job loss and income loss and so many other pressures over the last year. We need to marry to eviction-related policy affordable housing generation policy as it relates to zoning reform and fair housing reform. The Biden administration is already taking some action on fair housing policy, and it's important to keep in mind that a lot of zoning reform must happen at local levels. And so that's going to be a very important area for advocates to focus on, not just at the federal and state level. I would also urge that policies that promote the advancement, adequate supportive infrastructure for and living wage for community health workers is critical, especially since in MLPB's experience, community health workers and their peers are powerful, powerful partners to people in demystifying their legal risks, rights, and remedies and advancing health through that important mechanism. And finally, on that note, every state has its own rules around who is allowed to participate in legal problem solving. It's part of professional responsibility in the legal profession. And we need to do more to revisit whether those rules are being used to expand access to justice and therefore advance health, or whether they are being used to shield certain interests. So there's a lot to think about. And some of this is intuitive and some may be off the beaten path, but I hope that folks think about advancing the CHW role because it's so important and powerful.